let's talk pain medications in labor and birth. And if you are choosing to labor and birth in a hospital, you've likely contemplated if you want an epidural or not, but it's unlikely that you've really thought about every single type of pain medication that might be available to you at the hospital that you choose to labor and birth at. Before we get to specific drugs, I would like you to know the difference between an analgesic and an anesthetic. Analgesic is something that can reduce a sensation, whereas anesthetic blocks that pain sensation. That's the goal, at least, that it would totally take away the pain. So with that in mind, we're going to talk about the first four drug types that I have here. These are systemic medications, meaning they will affect the whole body, mind included. So just know that going into it. The three classes of drugs that you might be offered if you would benefit from therapeutic rest, or some people call it morphine sleep. These three drug types do cross into the baby's system, so they can give as long as birth is 2+ hours away, only because its effect on the baby. A lot of times what you see in moms where they get really relaxed, really tired, really sleepy, you can see that in baby. And once the baby's born, you want a baby who is vigorous and lively and has good reflexes, not one that's real sleepy and drowsy. These are all analgesics. These are all going to reduce the sensation and perception of pain. And if you look at this third one here, the inhalation analgesic, that one is the nitrous oxide. It is given by mask, and the patient self-administers it. And it's typically done right before a contraction. It's very short acting, little to no effect on baby. However, in the US, it's very rare. I do think that it's kind of coming on the scene. Birth centers are going to have this available, maybe more so than a hospital, but some hospitals do have this available. Moving on to local meds, these are anesthetics. Okay, so these are your cane drugs, and these are used to block local nerves from transmitting that pain sensation. So you have the perineal block that can be done when you're crowning, that can be done before an episiotomy, that can be done if it looks like you're going to tear, that can be done before they suture you. Typically it's lidocaine, and so your perineum is the area between your vaginal opening and your anus. So that's likely where a tear is done, and it's always where an episiotomy is done, in that region. So they would use lidocaine and do a few injections to help numb that area. A paracervical block is just done on either side of the cervix, or the bottom of that uterus. That's going to help decrease the sensation or the pain felt at the lower uterine segment. So the dilation, effacement, all the things that are happening there at the cervix of the uterus. The pudendal block is there to block the pudendal nerves, which are on either side of the vaginal wall. This aids in a decreased sensation, especially if forceps are being used for your birth. Moving on now to the noraxial meds. These are the ones that you've heard of, the epidural, the spinal. There are different types, so we're going to break it down. We have spinal narcotic and epidural narcotic. These only have narcotic in them, so any of the narcotic side effects that you've read above are going to also apply here. Moving down, we have epidural anesthesia only. So these are your cane drugs. And any of the anesthesia that you've read about above, any of those effects will likely translate and apply here as well. And I know I'm running through these kind of quick because I wanted to get here. The combination epidural seen here, which is your narcotic plus anesthetic, is the most common epidural that we see in the US. With all of these, you would really, really try to be in active labor, like 6+ centimeters before getting these, only because a lot of the effects are dose correlated. So the longer you have a medication given, the more prevalent a side effect may be. However, a really good thing about this combination epidural is the side effects are more mild than if you would have had an epidural with just anesthetic or an epidural with just narcotic, just because you're utilizing less dose of those meds working together synergistically to help give a beneficial and desired effect. If you're at a teaching hospital or a university hospital, you may come in contact with a CSE. A CSE is a combination spinal epidural that uses spinal narcotics with an epidural anesthetic. The epidural catheter is placed at the same time as the spinal injection. However, the spinal narcotic is going to be given first, and then fluid will be run through the epidural catheter once there's breakthrough pain that occurs, which is likely transition. Any of these noraxial meds are going to be given around the spinal cord. They're going to target the nerves of the central nervous system. Moving on to the anesthesia used for cesarean sections. So here we have epidural with anesthesia only. We've seen this one before. However, the difference between utilizing this in labor versus cesarean is they'll start with this higher dose if you're having a planned cesarean. If you're in labor and you have an epidural, then they'll just give you a boost or increase your dose prior to surgery. Next is our spinal block, which is our anesthetic only spinal, and that can be given and take effect almost immediately. Everything else is very similar to the epidural. Next is general anesthesia. There are 2 steps when given general anesthesia. Step 1 is the induction. Step 2 is inhalation. So step 1 is given through an IV, while step 2 is given with a mask. And because this is a general anesthetic, the goal here is that you would lose complete sensation and complete consciousness. We are seeing less and less general anesthesia used for cesareans. However, there are still those small amount where this is the best option for the life of mom and baby. As a bonus here, I went ahead and put common postpartum meds that you'll see. You'll likely be offered ibuprofen in those early hours after birth. This can help with some of that pain associated and the cramping associated with uterine involution, which is just when the uterus is trying to shrink back to size. It can also help with inflammation or swelling if you've had any tearing in the perineum. And good old Dermaplast. This is that lovely spray that you can spray on your perineum. In those first few days, again, that just helps desensitize or reduce the sensation of pain in that area, especially if you've had a tear. So that is the summary of common pain meds that are used in labor and birth and then shortly thereafter. And of course, there are more natural or less invasive ways to cope with pain in labor, but that's for another day. Blessings, sister.